Journey Clinical believes that the therapist is the center of this model. Delivering ketamine-assisted psychotherapy is the gold standard of supporting mental health care in this way for patients. And so we're really honored to be able to partner with our member psychotherapists to care for our shared patients on an ongoing basis. So we really consider ourselves your in-house medical team there to support you for whatever you need for your patients. So I think I want to just start us off after that little introduction by allowing the other people on this panel to introduce themselves as well. So let me just pass it over to Crystal.
Thank you. I'm Crystal Myers. I'm a licensed professional counselor. I have a group practice in Richmond, Virginia, and I started partnering with Journey Clinical about a year ago. I'm Lynn Wolf. I'm a dual certified nurse midwife, psychiatric mental health nurse practitioner, and I started with Journey about a year ago, almost, quite. And I also have a private practice, women's mental health specialist that does all health.
My name's Seth Reiner. I'm an LPC in practice here in Richmond area. I own a private practice called Lexington Counseling Center, and I've been with Journey Clinical doing CAP since last February.
Wonderful. Really happy to have you guys here. So I just want to add one other thing that I didn't mention, which is around collaborative care being more than just coordination. So we're not just, passing notes back and forth and making sure everyone is seeing the same information. We're really here as your partners. And I think to that end, one of the things that our clinical team does so well is share information and education about ketamine and ketamine-assisted psychotherapy with our member therapists and with our patients. And so, Lynn, I would love to pass it to you. Wondering if you could give a brief overview of ketamine and its effects on the brain, just in case anyone who is watching the live stream may not be as familiar.
So ketamine is really an amazing drug. It is safe and effective. It's been used for many, many years, traditionally in anesthesia in a hospital setting. But what we've also discovered over the years is that it is a very effective and fast antidepressant. So it works by increasing the neuroplasticity of the brain, allowing you to open more neural pathways. What's really magical about it is that that's just one piece of it. The therapy and the integration side is so vital because once we achieve that open window of critical development period, that neuroplasticity, we can really get in there, and I like to say dig out old wounds, right? Find things that maybe we didn't even know we needed to work on. And I have just seen so many people's lives change using this particular modality, ketamine-assisted psychotherapy.
Wonderful, thank you. And as Lynn said, this medication provides such an opportunity in the space of psychotherapy to make these really big changes. And the gold standard of ketamine-assisted psychotherapy specifically, probably could just say psychedelic-assisted psychotherapy, is a preparation session, a dosing session, and an integration session. So I wanted to pass it over to either Crystal or Seth or both. If you guys want to share a little bit about what happens in each of those sessions, that would be great.
Absolutely. So starting with some of the screenings, we have to determine if someone has any medical conditions that would exclude them from participating in ketamine-assisted psychotherapy. At my office, if someone calls in to schedule an appointment, I talk with them, we go through all of that information, I send them some screening documents, and after they send those back in and we've determined that they're appropriate, then they come in for an intake session. We go a little over their, more in depth into their history. And cover any risks and benefits, talk about potential for this neuroplasticity that we would then reinforce with psychotherapy sessions. And then we're going to move into that preparation session where we really talk about what are you hoping to get out of this? What's the dream? What are your goals? And I also like to talk with people, what would it be like if that didn't happen? Because sometimes ketamine takes you where you need to go rather than where you want to go. And that's where the healing is. So we really process through that. We talk about whether they've had a history with psychedelics and what that was like, who was supporting them in their lives, because you do have to have a chaperone bring you to the session, and also drive you home. So just really digging into some of those internal resources, external resources that they maybe are areas of resiliency that they weren't aware that they had, and just talking about it in a different way in support of their healing really helps to bring that stuff up as an available option. During the dosing session, they would come into the office with their chaperone. I typically schedule those for 3-hour sessions. I have one client who likes to really process for about an hour before she's ready to take her medicine. And I tend to be very humanistic oriented, and support the client in whatever it is that they need, because safety is the most important thing in psychotherapy, and especially when you have an altered conscious experience. So most of my clients talk throughout the entire dosing session, and then we leave time to process later. And then they will come back within 24 to 48 hours for that integration session where we really reinforce those new neural pathways. Oh, those memories are chunked together in a negative way. Well, here's a new pathway that ketamine helped to create where we've got some good memories that are chunked together. You had an experience of safety with me in this room, and now we're going to talk about all those things that came up to help reinforce. You can choose this new pathway now that it's been opened.
Yeah, so I'll speak a little bit about how I integrate it, particularly with EMDR. And my specialization is really in EMDR and treating complex PTSD, grief, substance use, various things. But when someone comes in and they're interested in doing CAP, I want to talk to them a lot about what CAP is. I want to talk to them about what it isn't. I want to field any questions from them and concerns that they may have to help them feel more comfortable. And just, like you were saying, Chris will determine, is this appropriate for you? With incorporating EMDR with this, something that really stuck out to me is how well even just the language and how we talk about the structure of EMDR fits with the language and structure of CAP. And so having that preparation process with EMDR is huge. Like, you cannot move forward into like any kind of trauma reprocessing without being adequately prepared and making sure that you have a boat big enough to catch the fish that you're looking for. And so utilizing CAP to maybe even do some of that resourcing for folks, but also creating that EMDR treatment plan and doing all of that work, getting some reprocessing in before we do any kind of dosing, so we can maybe get a baseline for how they're handling reprocessing in the absence of ketamine. And then looking at their treatment plan, going back to that primary issue that they're hoping to address and utilizing that to guide their intention setting. And so making sure that everything's really falling in line with what they initially set out to do with their EMDR treatment plan. And so much in the same way that you were saying, we do a 3-hour dosing session. And so that first hour, we're checking back in on the intention. We're making sure that we've got everything set up well for them. They're feeling comfortable. The light's right, the music's good. They've got some snacks that they can have after they come out of the experience, because they've typically been fasting for several hours. And yeah, just making sure everything is really squared away so that they can step into that experience feeling like they really know what they're there to do. And so yeah, measuring expectations and mitigating as much of that as we can. And then taking that third hour to really do that initial kind of integration and debriefing of, what just happened, and helping, take some notes on some key metaphors or symbols or just concepts and material that came up to them during that time. And then making sure at the end of that they know how they're going to make the best use of that next 72 hours over that primary integration period. We have a follow-up session for integration, but also making sure they know what they want to do to maximize that work that they've just done in the dosing session. So that's journaling, if that's going for walks, if it's having some helpful conversations with some folks, or doing anything like that. And then when integration comes around, that session, coming back and working that EMDR back in, maybe something really helpful came up during that CAP session that they can turn into a resource that can help them further as just a general coping skill or within EMDR reprocessing, or we can pick a target that maybe their intention was initially set around. And then we can start working on that target while they have that added neuroplastic benefit to kind of maximize their time with reprocessing.
Thank you so much for sharing that. And one thing that I heard that I really love is we all hold the preparation, dosing, and integration structure as the gold standard. And I hear such an acknowledgement in both of your descriptions that each patient is different and you're meeting each patient where they are. And that brings me to the next thing I want to talk about, which is how Journey Clinical fits into that model as well in our collaborative care partnership with therapists. We do offer patients a service called medication management as well as CAP. And the way I like to think about medication management is you may have patients who are already on traditional psychiatric medications or whom you think could benefit from traditional psychiatric medications. You may think they would be a good candidate for CAP as well, but I sort of like to think about medication management in a before, during, after relationship with CAP, that maybe you have patients who just aren't quite ready to do ketamine-assisted psychotherapy, but they're still thinking about it and working on it. You can still work with the Journey Clinical medical team in this collaborative care partnership to provide them the psychiatric medication that's working for them right now and deepen that shared care while they're doing ketamine-assisted psychotherapy. Lynn, you can talk to this a little bit, but always helpful. Our medical team will always need to know what psychiatric medication they're on, and it can be really beneficial to bring that all under one group of care practitioners. And then after ketamine-assisted psychotherapy, if you have patients who are moving on to do maintenance doses, they may still be taking traditional psychiatric medications. They may feel more comfortable keeping that same care team and continuing to do medication management in partnership with yourselves and Journey Clinical as well. So I wanted to pass it over to Lynn to talk a little bit more about what does medication management look like at Journey Clinical? What are those visits like with patients?
Well, truthfully, I've only had a few of those because if their insurance is only covering some states so far in medication management, but
Fast growing.
yeah, fastly growing and expanding. But what I really like about it is, and I never pressure anyone into changing into med management over with us, because a lot of people are really well established with the psychiatric provider that they're seeing and really feel safe with that prescribing relationship. But what I really love about being able to offer that through Journey is exactly what Nora said. Sometimes your needs will change, right? After a series of CAP sessions, you may not actually need to be on such a high dose of whatever antidepressant or whichever medication you're on. Or perhaps you have goals of weaning off of the medication and sticking to some sort of maintenance with the ketamine-assisted psychotherapy as well. And so all of that can kind of tie in together. What a visit kind of looks like, sometimes it's combined. They come back for, I'm ready to do another round of sessions, but can you also fill my Prozac? And other times they just make an appointment with me to, talk about the medications they're on, prescribe, etc.
Perfect. Thank you. And I do want to talk a little bit more about something that both of you raised already as well, which is we think about CAP, we think about ketamine as a tool in our therapist's toolkit, and we know that each of you have other specialties. Seth, you mentioned EMDR, and Crystal, you've mentioned quite a few things in our conversations. So I wanted to pass it to Crystal first. I'd love to hear the types of clients that you work with, how you support them with CAP, what kind of outcomes you've seen. Just give us a little glance into your world.
So I primarily work with adults who have a PTSD diagnosis, typically complex PTSD, even though that's not DSM diagnoses yet. And many of them have been in therapy for years. Most of my clients I've been working with since I started in private practice around 2016. So it's a long experience of therapy. And once you have that trusting relationship with someone, you want to keep that going because the likelihood of regression if they stop working with you is actually pretty high. That's pre-ketamine. Post-ketamine, I have one client who shows up in such an amazing way to do the deep work that ketamine is allowing her to do. Part of the, you all know this, part of the diagnoses for the criteria for diagnosing PTSD means that you avoid trauma reminders. You don't want to look at material because it's so upsetting. Your system was overwhelmed to the point you couldn't process it. So you certainly don't want to dredge that back up. EMDR does help, and clients, I will do EMDR during the dosing session. Some of them like to hold on to the tappers. I am very humanistic oriented and pull in a lot of integrative elements of the therapy that I've been exposed to. So like AEDP, EMDR. I don't use CBT so much, but there are elements of that in it. Very humanistic and very empathetic and supportive, because people that grew up in an environment that was not safe and healthy have trouble connecting with themselves and other people. So whatever it is that they need in a moment, we're going to try to figure that out, and I'm going to do my best to help create the circumstances where they feel that safety. Ketamine has added this amazing experience of people having therapeutic gains after the first session. And certainly that's the reason the integration session is so important, because you want to reinforce all of that. And there can be some regression between sessions, but that's okay. That's what our body does. Healing is not linear. It's going to take a circuitous route, and we're going to figure out how to get there. And so with each dosing session and integration session of ketamine, it helps people have hope. Whoa, I felt so much better. A week later, I might have fallen back into some of those more upsetting experiences, whatever their coping skills were before. But that's a week instead of 3 months. So it's giving them hope and a tool that they can use to really believe that healing is possible. This isn't just me like reliving this or trying to keep from reliving it, honestly. I can actually feel better.
Can I say one more thing about that? I only see this from the prescriber side, right? Like I'm not in the therapy session, but when people come back for follow-ups, the kinds of things they say to me, I'll ask them, how did it go? What was it like? And it ranges from like, I was an alligator to I saw everything in black and white. And I ask sometimes, and how do you feel like that relates to what you need to work on? And the answer is always yes. I say, what does it feel like? What do you feel like afterward? And the answer is always something along the lines of, I feel lighter, but more grounded. I feel like this depression, this anxiety, this trauma is starting to release its grip. And it just gives me goosebumps every time.
Yeah, I'll add a little bit more. I was doing a dosing session yesterday and got permission from that client to, like, hey, give me some feedback. Like, what would you want people to know about your experience with CAP? And the way that client phrased it was that it feels like it really helps to just be able to kind of push the boundary of the therapy that they've been doing for several years. And I mean, like you were saying, Crystal, it's like I think my favorite ideal client is the person who's been in therapy for years, like sometimes decades, and being able to, it's like, I feel it's, at that point, it's like, I'm down to try anything. So it's like, all right, let's get creative. Let's like do this EMDR thing, and let's, integrate some CAP. Let's do some experiential kinds of therapies and things, and just really take like what they're coming in with, and let's get you out of that cycle of just being in therapy forever. And so, they really have felt the benefit of being able to push the boundary a little bit and like kind of step out into that and do this new thing. And just felt like, in their experience, it really added to the EMDR reprocessing that we were doing, and, can kind of like make some of those targets feel a little bit more approachable and feel a little bit more tolerable once they get in there and start actually doing that reprocessing work. And I also work with a lot of Christians, and Christian counseling is a big focus of mine. And I went back and forth, tirelessly trying to figure out if I was going to be like a biblical counselor or a clinical counselor. And so I feel like I was able to strike a good balance, in the clinical setting. And so I get to talk to a lot of Christians about EMDR and CAP and all of that stuff too. And being able to calm some of their particular concerns around it is really helpful. But yeah, I see a lot of complex PTSD, seeing a lot of like treatment resistant depression, and seeing someone be able to even just start to distinguish between feeling like just a really appropriate and normal like sadness, and distinguishing that from like a deep depression, and knowing that like, oh, this is the kind of thing that typically might have, thrown me off for like a week or two. And seeing that not happen, and, alternating, our rhythm tends to be like every other week we're doing dosing. And so they're well outside of that 3-day window, and they're still seeing continued benefit, continued change, continued, support for the other work that we're doing. So I think it just adds so much.
Just for those in the audience that don't know what EMDR is, who would like to speak to that?
I can help that. Yeah, so EMDR is eye movement desensitization and reprocessing. Sorry, eye movement desensitization and reprocessing. And so it's kind of I always describe it to people as sort of a non-traditional therapy, meaning that it's different from talk therapy. And I don't know if I'll be able to refer to it as non-traditional therapy for much longer, because I think it's becoming a lot more mainstream, and a lot of people are incorporating it. But essentially folks are utilizing these like bilateral movements, typically like eye movements, but then also there can be tactile bilateral stimulation, and also auditory. And so you're utilizing that, and you're really making good use of the brain's like natural storage of memory, and the way that those things are all connected together to identify really those root experiences where people started to form these faulty narratives about themselves. They took away messages from something that happened to them that just aren't the truth about who they are, aren't the truth about really what the world is, or what relationships are, or any of that. And they're able to reprocess it, and not necessarily like go back into those memories. You're not like launching them headlong into that traumatic experience again. You're really trying to help them keep a foot in the past, a foot in the present, stay with you, and really be able to just observe what they're experiencing in the moment. And it, speaking again to CAP, and why, I think the two of them work together so well, is that down regulation of the default mode network that we see with ketamine. It's like that goes so in tandem with what we think is happening with those bilateral movements with EMDR, and the process just looks so similar. And so that default mode network, carrying all of really kind of where those core beliefs are all housed, that a person's taken away from those traumatic experiences, and being able to like refine those stories, and edit them, and separate themselves from that thing in the past. So when someone successfully reprocesses a memory with EMDR, they say things like, somebody just yesterday was like, the moment feels smaller and I feel bigger. Like they feel like they're their adult self when they think about that, and not that 7-year-old or whatever. It feels farther away, and it's like it's in the past, right? Which sounds kind of like a no-brainer statement, but for the person who is wrestling with PTSD, it's like those experiences are happening again. They're re-experiencing, and so helping them take a different stance and see it from the present. Yeah.
Thank you.
Yeah.
Thank you for that question. That was a great question. And I have to say, I feel so inspired whenever we get the chance to hear about the work that you or our members are doing. So thank you so much for sharing. It's incredible, the life-changing healing that you're bringing to your patients. We really appreciate you so much. And the other thing that came up for me as I was listening to you is similar to what I said before. It's amazing the range of mental health conditions, lived experiences, and challenges in patients' lives that you are supporting and supporting with ketamine-assisted psychotherapy as well, that CAP can be really so beneficial for so many mental health conditions and challenges. Which brings us to the final part of our conversation, which is about accessibility of CAP and the cost of CAP, and how we're seeing this grow in the future. So first, insert applause track. I'm so excited that Journey Clinical accepts insurance for patients in, I think it's 5 states now, and it is growing literally every single week. So that matters so much to us, providing that accessibility. The clinical visits can be covered by insurance. The medication is still an off-label prescription, so that's not covered, but maybe that will change in the future too. Certainly, it just depends on how long that future is. And we're really excited about that. And then there's other ways that people are working to make this more accessible for their patients. So there's options of group CAP, couples CAP if that's appropriate, obviously.
You can bring it, maybe it's a little farther.
This way?
Yeah.
Here? Oh, great. Yeah, I'm less loud. Thank you.
It's messed up.
Various ways that our members are also working to improve accessibility. Some members offer sliding scales for people in their community who can't afford the full price, and Journey Clinical can match those as well. And so I wanted to take this conversation there. I wanted to hear, it doesn't have to be about cost necessarily. You can talk about pricing and cost, and if you know how you manage the cost of the dosing session, since it's a much longer session. Definitely feel free to talk about those as well. But one thing that I'm just hearing even from today's conversation, Crystal, you said the phrase, that was before ketamine. And so what I really want to hear from you is, how have you seen your practices change as ketamine has entered your practice as a tool? And how do you see your practice changing into the future as you look at the community and think about, you know, improving accessibility and how you want to grow that out?
So I'm really excited about the counseling compact that should be coming soon, where many states have agreed to, your license will actually, you can work in different states without going through the process there. So in my mind, that's going to make ketamine-assisted psychotherapy an option for a lot of people that maybe wouldn't have the opportunity. As far as how it's changed my practice, I've actually started limiting my practice and just discharged a lot of long-term clients within the last 2 weeks, which was really hard, so that I can exclusively work with people who are seeking ketamine-assisted psychotherapy. And the reason I do that is because I've seen people's lives transform over and over and over, and I want everyone to have the opportunity to do that. It is a big time commitment. We're talking about at least 4 hours a week, and that's just in my office. So getting to my office and actually you doing the deep work of integration when you're not with us or in the office with me, that takes time. So there's a big time commitment from clients and from the therapists. And I was so disappointed when the FDA did not approve MDMA. I plan to, when psilocybin and MDMA are made available in the therapeutic communities, I will also be offering that, because there are so many people have been struggling for years to try to be healthy and have a life that maybe they feel more in control of, instead of being stolen by their traumatic experiences or their depression, whatever it is they're dealing with. And I think making those avenues of healing available to people is the future of us making people healed, instead of continuing in this cycle of, I've been in therapy 10 years, I've tried this medication and it's no longer working. So whatever we find that works for people is what we should offer, and I'm going to be a part of that.
Yeah, I'm excited about being able to expand things out into maybe offering some groups. It's like something that's an interest of mine in the EMDR space as well. And there's always like new group protocols and things coming out. It's like really big in like the disaster response kind of space. So you can think of like the hurricane and things recently. A lot of EMDR therapists are like, you know, jumping down to help with some of that stuff. But I think from that, just there's been a bigger focus on group stuff and group is, I think, probably like the most underrated thing in the therapy world. I think it's something that a lot of therapists maybe don't know enough about, and a lot of like clients don't know about, and they don't know the benefits of it. It's like people encounter group stuff maybe like in drug rehab or in like a psychiatric hospital setting or something like that. But it can really maximize like the amount of like direct contact that you're getting with people, but also adding this like communal aspect to it. And so I think with CAP, it's really no different, and I'm excited to see how that can fit in with some of the EMDR groups and things. And currently I do EMDR intensives as well, and so people can do as much as 6 hours in a day of EMDR, and I'm excited to see how CAP can help with that, whether that be in psycholytic dosing or maybe doing those intensives within that integration window. And really CAP's just it's such a new thing that there's just, the sky's the limit, I think. And having the ability and the freedom to apply what we already know about therapy in general, about EMDR, whatever work we've been doing, and really having the chance to be creative and collaborate with other professionals within the journey space. And there's just so much like consultation that's provided and all these things. So one element of my practice is like I want to do the direct client contact stuff, but also want to do more like EMDR consultation and just general consultation and supervision for other therapists, and including things like CAP with that. And so like creating trainings around how do you integrate EMDR and CAP, or just CAP in general. What are the ethics of utilizing CAP, and all of those things too, to help kind of educate people and make it something that's approachable for therapists. And so I think one of the first steps in making CAP more accessible to clients is making it more accessible to clinicians, making it more approachable so that people can learn about it and kind of demystify some of it, and get some answers to some important questions so they can feel comfortable about practicing.
Well, thank you again for sharing. We're going to open it up to any questions. So I think I'll pass a few with you.
Sure, I mean, I'll just
Okay.
say from here and you'll, so the first question, I think if we could talk a little bit more about the nitty-gritty of the scope of practice for the psychotherapist and how the ketamine is actually administered, because the question is, how do I incorporate using ketamine in my psychotherapy if I'm not a prescriber? So making sure we clarify
Perfect.
that.
Collaborative care model question.
Yes.
So this is what's at the heart of collaborative care, is that our Journey clinical team can support you and your patients as like an in-house medical team, as your clinician, your prescriber. And I'm gonna pass it to both Lynn and either Crystal or Seth, whoever's most excited to answer this. Lynn, do you want to talk about how the session with the patient goes?
Sure.
Yeah.
So generally people are referred to me by either their member therapist, or they will find us if they don't yet have a member therapist, and then we can pair them with one or match them with one. And so for an initial intake, basically, I get the entire psychiatric, medical history, learn a little bit about each person, what they're hoping to achieve, making sure they're actually a good candidate. There are a few absolute contraindications to taking ketamine. One of them being a history of, schizophrenia or being acute psychosis. So we make sure that you're a good candidate for it. And then basically I give you a little bit of preparation that your therapist is likely to reiterate, write the prescription. The medication gets actually mailed to you via UPS from our compounding pharmacy, and to the patient. Yes, to the patient, sorry. And then the patient can either do their session remotely or in the office with their therapist, depending on what their preference is. Does that sound about right with what you guys do? Okay.
Will you just clarify the format, like it's sublingual?
Oh yeah, okay,
Yeah.
so we do, there are various forms of ketamine out there, right? You've probably heard of the IV clinics, IM, intramuscular injection, or the nasal spray. What we do at Journey are the rapid dissolving sublingual tablets. So they are absorbed actually through the mucosa of your mouth. We don't swallow the tablets, you just let them dissolve about 12 to 14 minutes, switch it around and spit it out, and that it's weight-based dosing. And so initially we prescribe for 2 sessions, you do the 2 sessions, and then you come back for a follow-up, and we determine whether or not we need to make any dosing adjustments, because every person's body chemistry is a little different. Everybody metabolizes a little bit differently, so sometimes we have to increase or change the dosing.
So part of the collaborative care model is that when you are a member therapist, you'll get notifications that they've seen their doctor, the prescription has been written, and it's on their way to their home. And for myself, when clients come in for their dosing sessions, I actually like to print out, especially if it's the first session, these are the ways that your doctor has said that you can take the medication. That way, neither of us are confused. It can be for the first couple of times, and even after the 8th time, it can be a little unnerving for people, because ketamine is going to take you where you need to go if you're willing to surrender to it and go there. So we want to have that information in front of you so there's no confusion in the dosing session and no mistakes are made. I do actually like to ask them to tell me how they're going to take their lozenges. I have them open it up because the doctors the nurse practitioners give a lot of leeway about at what time during the session you can take them, or if you take them all at once or separate. So we talk about how you're going to do it, what your plan is, knowing that could change after you put your medication in your mouth and swish it around. So we just have it open because it's going to be a little harder for them to pull those things are really tamper proof. And if you're trying to open those after you've had some of that in your mouth, swishing it around, it gets very difficult. As a member therapist, I don't help them with their medication. They have to say, this is what I'm doing. They have to open it. They have to lay it out. They also, as part of this experience, they have to take their vitals before they put the medication in their mouth and before they leave the session. So they also are responsible for doing that. I'm not a medical professional. That's why we have Lynn and the other prescribers that work with us. And so the part for me is just helping to remind them, what did your doctor say? Let's take a look in the Journey clinical portal to see what your doctor said your threshold for your blood pressure and heart rate is. And prescribers have different ideas about what that needs to be. So I always try to write that down in the beginning of the session, or we pull it up and look at it together just to make sure that we are following the recommendations of the prescriber.
And then every time for the perspective of the therapist, whenever I prescribe, you get a message from me talking about, this is what the max dose should be. This is, basically the basics for that particular patient. And then we can message each other in the portal. And so if there's ever questions, we're able to collaborate or get on a call or anything like that. So we're not working in silos, which is really great. There's always some ability to I need to talk to the prescriber because XYZ, and then we're able to do that.
I also want to add to that too, if you are in your session and you have an adverse event, like someone swallowed their ketamine, and yes, that happens, you can text Journey Clinical and there's a medical professional on call who's going to get back with you really quickly because they know how serious this is and they want to make sure that you're supported and our mutual client is supported.
That leads us really well to another, and
Oh,
you might be able to touch on this
Well,
as well.
I had one thing
Go
about
ahead.
the dosing. So like when we're in that first hour of that dosing session, we kind of I asked them at the preparation session, like, hey, looking ahead, what do you think you might want to do in terms of dosing? Because there's some variability in what they can do. And they'll tell me, and I always let them know, I'm going to pretend on dosing day like you didn't ask me that, and I'm going to ask you again. And then, if they choose to maybe do 2 of those 250 tablets at the beginning, and then they said, I'd like to do the booster, I'm going to ask them again. I'm going to ask them so that they know every step of the way. It's like they're making the decisions, and they can always say, I don't need the booster, no thanks, or I only want to take 1, or they show up on dosing day and maybe they don't want to do cap at all, like something else has come up, right? It's like we can always, they're not hopping on some runaway train where they can't walk anything back or change their mind. So it's just constant communication with them and really being with them every step of the way.
We have a really important question. We touched on it, but I think we can share a bit more. It says, I am an EMDR therapist and I'm super interested in how that can be integrated with CAP now. I'm a bit nervous about starting with CAP since it seems like a medical event occurs. How do you handle it if a client has a reaction, or does that not happen much?
Those are great questions. So several of my clients actually like to hold the tappers during their dosing experience. And that's actually even without CAP, it helps people that have really high levels of anxiety stay more in their body so they're actually processing. During a dosing experience, I will put them on low and slow because I want them to, their body and their brain to slow down a little bit to actually be able to be present with what's coming up and process that. And so I don't know that we talked a little bit about intention. I think we've all mentioned it, but that is really, really important, setting the stage for what may happen during that session. One of my clients who has a history of just really significant trauma, even comparatively to other people that have complex PTSD, she was really worried that going into it, she would have to remember every instance of trauma that she experienced. So really holding the tappers, and she processed a lot somatically, but it did not come up into her conscious awareness. She just felt lighter. She felt like she had worked through a lot of things that now she doesn't have to dig into with traditional talk therapy. And with the EMDR, they say the client can say as little or as much as they feel like they need to. And it's the same thing. They are experiencing an altered consciousness during the dosing session while they're holding the tappers, or you're doing some form of bilateral stimulation on their body. Would not suggest eye movements at all, because that ketamine can distort their vestibular experience and they may be dizzy, and we don't want to introduce anything else there. But definitely with the tappers or bilateral tapping, and it's been fluid and easy. And she would ask for the tappers, but then when she realized she didn't need them anymore, nope, not today. I think I'm going to do it without it. So it also built some agency and empowered her to really be able to say, this is exactly what I need, and you're going to let me do that, so I'm going to ask.
Yeah, I was talking about it a little bit earlier, but I think they just fit together really beautifully, EMDR and CAP. I think, yeah, the ability to do things just so in tandem, and like the way that setting that intention can like really complement what they've already done in like that treatment plan, creation of target sequencing plan, whatever you want to call it. I think just every step of the way, it just makes a lot of sense to me. I'm always happy to talk to anybody that like wants to find me and ask me more questions about it. I do consultation for EMDR and basic training facilitation as well, but I think they just pair together really beautifully. I just couldn't talk about that enough.
And then I'll just speak to like what happens if the medical event occurs. So generally the things that are most common that I hear about is somebody's blood pressure will be outside range maybe after the session, because one of the potential side effects of the ketamine is it can raise your blood pressure. The most common side effects I hear about are nausea, which we also send medication called Zofran or something else depending on the patient to help prevent that from happening. So nausea, a little bit of vomiting, a little bit of drowsiness, those are the main things. And then sometimes raised blood pressure. Obviously if things are just like the control, blood pressure is through the roof, the patient's feeling really off, like that's, we go to urgent care or to the ER, right? We call her right away. But if it's something a little more mild, the patient's blood pressure is a little elevated or something like that, there's the ability to text the clinical team. The prescriber will also get an alert if vital signs are out of range or if there's an adverse event. So there's a little bit of safety built into that.
Absolutely, and that's a 24-hour available access. So at whatever time you're working with your patients, or at whatever time your patient might experience an adverse event or something they're concerned about, we're available
Within minutes.
within minutes.
Yeah. And just while I look too, if you could maybe paint the picture of what a dosing session looks like, because that's sometimes an aha moment for people, especially with like the nausea. It's like,
Who wants to?
Go ahead.
Sure. Yeah, so they come in, we Again, make sure that setting is all good and comfortable for them. I have like blankets and pillows, and there's like a couch with a chase, and do you want to lay this way? Do you want to lay that way? Do you think you'd like the blanket? You take your shoes off. People usually come in wearing some pretty comfortable clothes, and try to keep the lights low, blinds down, because again, there's just so much more. Like people's vision is just a lot more sensitive, so even just a little bit of light can feel kind of overwhelming. And so you've got like a what's it called, like eye mask, blindfold kind of thing, that they'll wear during that, and headphones so that they can hear really just the music. And that first hour, we're just like reviewing everything, making sure everything is set correctly for them. We'll like check like volume and stuff on the headphones and all that kind of stuff. And just making sure they feel good to get started, so they can.
And check vital signs.
Yeah, check vitals. We'll check vitals. They'll like go after that first hour before we actually do the dosing, take a bathroom break. We'll get some water and stuff that's like there for them, if they need it. And then when they actually are taking the medicine, I'll do some kind of like a guided meditation, or if they're like particularly averse to the taste of the tablets, maybe I'll try to do more of a like a hypnotic induction with them to help them better not focus on the taste and focus on some other things. And so they'll switch for the 12 to 15 minutes, and then if they had chosen to take the booster, they can do it then if they'd like. And then they get laid down and get comfortable, and I'll turn the music up a little bit. The music is really stuff that's just kind of I don't know if there's really like any music that you could say is really neutral, but like music that is just kind of like open and like maybe inviting, calm, just something that can help people settle in. Nothing that really would sound like too familiar to anyone. And they have their experience, and I'm there if they need me. I'm sitting really close by, and while they're doing that, I might be entering some things in on their journey clinical note, putting down that initial blood pressure and heart rate reading, and the notes of did they or didn't they do any of the Zofran or whatever. And then I'm just hanging by their side, and we talk beforehand about how are you feeling in terms of like physical touch. If you want to hold out a hand or anything, like I'm happy to just hold your hand for a moment if things get like a little rocky, and letting them know like, hey, I'm here to help you up to go to the bathroom if you need, or can hand you a trash can if you're feeling sick, or whatever it is. I'm just there for anything they would need. And then when they start to reach about an hour from the time that they initially took the medicine, I'll start to turn the music down slowly and let them know like, hey, we're getting to this time. You can only when you're ready, you can sit up and take everything off. So sometimes they'll just lay there for a minute and continue to focus on whatever they were, or just kind of relax for a moment. And then once they sit up, they'll drink some water, eat a snack, maybe get up, go use the bathroom again. I'll help them to the restroom and back if they need it. And then we just start kind of processing and debriefing, what's just gone on. And again, with EMDR, sometimes you can have people doing some bilateral as they're coming out of the experience. I haven't done any, like target reprocessing with anyone. Like at that point, I don't know. If somebody wanted to, I'd be like, sure, we can try it. There's no like real reason that you just definitely shouldn't do that. But it's like whatever's tolerable, and so then just taking that time to discuss any of those big things that maybe came up that they want to make sure they don't forget. Sometimes I'll give them time to like jot some things down and make sure they can remember what they want to, and set those intention practices that they want to do over the next few days, and schedule an integration session with them and talk a little bit about what do you think you might want to do during that session given what's happened today.
2 more questions that we can kind of, we have 5 minutes left, but we think we can do this. One of them is, what role can local medical providers play in your collaborative care model?
I love this question. So the collaborative care model has obviously the two legs that we've talked about, our internal Journey Clinical Medical team and our amazing member psychotherapists who are supporting our shared patients. Local primary care providers can also work with Journey Clinical in a couple of ways. We actually have a network of local PCPs, and we can work with you to, again, in the same way, support our shared patient with both psychiatric and therapeutic care. You can refer patients to us who may be seeking this kind of treatment or who may be seeking a psychiatry and therapy combined treatment. You can always refer your patients to us. And then we would have a bi-directional relationship where if we have a patient who's coming to us and really needs this primary care provider relationship in their local community and they don't have one, we refer patients to primary care providers as well. So it really is the third leg of this model, and I'm so glad that you asked so we could talk about that.
Awesome. And another question is, does Journey offer ongoing consultation for new therapists learning how to do CAP?
Great question, meaning like with the prescribers or
Well,
just in general?
that's a great thing to talk about, but also therapists are constantly in consultation with one another. And so peer consultation, we can definitely talk about that.
Oh my gosh, there's so much to talk about. So the answer is a unequivocal, absolutely yes. Education and continual growth of your practice is very much at the core of Journey Clinical. We have a fantastic training program up front. We have an ever-expanding curriculum of continuing education unit eligible courses on every topic you can imagine. If you're interested in EMDR, you should reach out to Seth, but also there's educational materials out there. It's really amazing. And we have the ability to work with our in-house medical team to, if you're just getting started and you want to talk to our in-house medical team about, hey, which of my patients do you think could be a good fit for this? I think I want to bring this patient to Journey Clinical. I have X, Y, and Z concerns. I talked to a patient about CAP and they had these questions. We're available for that. So you can either book a shorter visit with one of our clinicians to talk specifically about just one patient. You can book what's called a caseload consultation and talk with our clinicians for 45 minutes and just talking about your entire patient caseload or the people you want to bring to that session. So yes, we are highly available. All of that's included in your membership if you're a Journey Clinical member. And I would love to pass it to anyone who wants. Do you want to talk about the peer mentorship?
Yes.
Fabulous.
Oh my goodness. I am having trouble working in all the trainings I want to do. You only have so much time in the day, but there's so many amazing integration tools talking about different forms of therapy, EMDR, IFS, AEDP. I just want to sit and be a part of all of those. I actually am very blessed to be able to do a training with therapists where we're talking about attunement and tracking and how we're working on, instead of first order change, which is a change in behavior, we're working on second order change, which is a shift in your values. And I look forward to it. We do it every other week. And it's just such an amazing experience with other professionals all over the country who are bringing their cases that we talk about, and we get input from everybody. It's a really supportive community, and I love being a part of it.
Yeah, I think it'd be surprising to calculate the added value and like all the additional consultation and stuff that you can get. And I know I was looking early on for, are there any consultation groups for EMDR, and there were already a couple at least. And, I was asking on message boards and they kept, they were full. And so it really wasn't long before like someone else was starting one. And so I feel like Journey is really receptive to the needs of like the growing base of therapists. And I'm sure it's similar on the psychiatric provider side in terms of what you guys get, but yeah, there's trainings on a lot of things. It's tons of consultation, tons of networking, tons of help with like marketing or really anything you can think that you might need. I feel like they're very very helpful in providing things top to bottom to help you feel comfortable and prepared. Shadowing sessions is a huge one, and That's like super valuable to me early on. Like I was trying to shadow sessions every chance I could get. So I was like, I want to see if I can get as good of a grip as I can on like across the board what might happen. What do these sessions look like? And really, really helped me feel comfortable before I was willing to do it with any clients of my own. So yeah, there's tons of stuff like that. Yeah.
And I'll add just two more things because that was beautiful. Thank you so much for sharing. We also have peer mentorship one-on-one that you can sign up for with an experienced CAP provider who would be a member psychotherapist. And then I just want to plug our community. It's a community forum. And there were a couple of times in this conversation where you mentioned maybe the taste of ketamine, and I thought, oh, I wonder if member therapists would have that question if their patient really doesn't like the taste. Where would they find that information? These questions are all over our forum. It is such a wealth of knowledge, like you said. If you have a question, somebody else probably had it, and 17 people replied. And so it's really a wonderful resource as well.
And we're doing a lot of community events.
Community events.
Yeah. So that's I think all the questions, and it's just about 1 p.m. So
Thank you so much.
I want to, thank you everyone on the live stream. I'm glad that we figured out the chat being open, and thank you for these amazing questions. What amazing questions.
Absolutely, and thank you so much to Crystal, Lynn, and staff. It's really just a wonderful conversation. We're so lucky to get to work with you.
Yeah.